Okay, good morning. My name's James Danger. I'm an embryologist with more than 50 years' experience, and I'm doing these podcasts for IVF Daily with the view of bridging a gap between the information clients need to discuss with their doctor about their management plan and the latest publications being made in a particular area. The subject today is to do with women who have their eggs frozen and specifically what to do with your surplus eggs when the storage period comes to an end. It's based on a publication called Elective Egg Freezers Disposition Decisions Pathways, published by some Australian authors in Reproductive Biomedicine Online in 2025. So, elective egg freezing or social egg freezing is a strategy to improve a woman's longitudinal fertility potential with her own eggs in the absence of any reason for infertility or contraindications of pregnancy. Women typically undergo elective egg freezing when faced with a possible age-related fertility decline and wish to retain the chance of having a genetically living child in the future. Notably, there have been an exponential growth of egg freezing in developing countries, mainly due to changing technology, where the old slow freezing method, which resulted in very poor egg recovery, has now been replaced with a technique called vitrification that has produced spectacular survival rates of oocytes and spectacular retention of fertility. So the chance of pregnancy from these frozen eggs are now very real and very similar to eggs that have not been frozen. Elective egg freezers most commonly freeze their eggs with the full intention of using their eggs for themselves, usually without any fully informed plans of how they would dispose of those eggs at the time of freezing. But the interesting and unfortunate thing is most patients, however, do not return to use their eggs, with the usage rates around between 6 and 38%. In other words, up to between 90% and 66% of cases where have their eggs frozen never return to use them. And usually it's because they fall pregnant themselves or for other reasons. However, in this context, the low usage and constraints to storage limits, hundreds of thousands of egg freezers are eventually faced with making a potentially morally challenging and stressful decision regarding the fate of the embryos with some urgency because of legislation. They're faced with a disposition decision, which is to decide what to do with unused or surplus frozen eggs in storage. The disposition decisions are a topic of clinical interest. However, due to the issues of managing an unquantifiable number of frozen eggs in storage and a global shortage of eggs required for egg donation. So in this context, the clinics are torn between the desire to freeze your eggs with the potential of using them in future IVF cycles, so it's a future activity, or using those eggs to be donated to other couples. There is a huge demand in IVF clinics from older women or women with poor ovarian reserve to use egg donation to achieve a pregnancy. Therefore, clinics are under considerable pressure to encourage women who have eggs there frozen and no longer needed to donate them. And you shouldn't be under any illusion that there is considerable pressure by clinics on you to do that. While there are no storage limits in the USA, they can be stored for as long as you like. In many countries, such as Australia and European countries, there are usually about 10 years, and therefore there will be pressure on individuals who are approaching the end of the legislated storage period to make a decision on what to do with their eggs. The options faced by women with surplus eggs are either to discard them, donate them to another couple, either known or unknown, or donate to a research program. These decisions are complex for some women and often based on poor information at the time of having to make that decision. So this was the subject of the researchers who wrote the paper, and they're asking what were the decision-making pathways for oocyte disposal of for outcomes with elective egg freezing. I didn't say that very well. So the study was a cross-sectional survey from May to November 2023 in Australia. There are only 175 women 18 or above living in Australia, so it's not very many, that had electively frozen eggs with at least one remaining storage. The outcomes were the willingness to donate to friends or to family members, or to a couple advertising online for an egg donor, to an egg bank or fertility clinic for research, to discard them or to reclaim their eggs. That is, they can take them away and dispose of themselves. The results, but very simply, was that each of these different decision pathways had certain outcomes, and all the variables were significant for at least one outcome. The models accounted for substantial variance in willingness to donate. That is, there was a lot of variability in whether to donate them to research. About 45% thought they might consider research, to 75% to an egg bank or a fertility clinic. Across all the outcomes, a positive attitude was the strongest enabling factor. That is, if you want to make a decision, you have to be positive about what you're going to do and not be coerced into it. But the main attitudes were issues relating to other people raising their donor child, a desire to meet the recipient, empathy for other infertile women, or a concern for the well-being of the donor child, depending upon the outcome choice, whether donating for research or other factors. But basically, at the end of all this research, they said feeling favourable towards their decision was the important one. And even if you're going to discard it, the women should feel positive about discarding. That is, they should have no regrets. The two most prominent factors predicting the disposition outcomes were a positive attitude and a concern about other people raising a donor child. A positive attitude was the strongest and most consistent enabling factor for any decision they made, highlighting that the decisions are primarily driven by personal attitudes and are belief-based. So religion is an important factor. Across the three donating to other options, to friends, family members, or online or a clinic, concern was always raised about other people raising their donor child was a consistent, significant barrier. And they showed that this factor also fed into other attitudes. So in other words, if you already have a child yourself and then you're donating your eggs to another woman, there may be the chance that there will be a child that you may or may not know about that is biologically linked to you at some time in the future, wanting to make contact. There is another issue which is important, that is, if you have eggs frozen and you have not had a pregnancy, that is, you had eggs frozen with the chance of being pregnant in the future, but for whatever reason you never became pregnant, right, or wanted to have children, right, and then these eggs are donated to a couple who do have a child, then there is an issue. It's the same with sperm donation. That is, that you remain infertile, but someone else from your donated eggs are having children. That is a major issue. But the bottom line is they are all very individual and personal, and it highlights the importance of seeking counselling both at the time of freezing and of disposing of eggs. And the authors recommend that each clinic develop a set of support tools to help patients navigate this complex decision, and basically to start the decision-making process a long way out from any deadline. But I thought I'll just take this publication a bit further and talk about the clinic's role, because egg freezing for medical social reasons arose out of new vitrification technology, allowing significant recovery and viability of oocytes. But this technology is still fairly new in the last maybe 10 years. And so we don't yet fully understand the clinical implications of vitrification of eggs. The eggs themselves are a very vulnerable part of the development cycle, and many of the genetic issues that arise, called aneuploidy, arise at this time. Social and medical treatments of like cancer usually involves considerably long periods where the likelihood of loss of contact with the woman increases. But also, like with cancer treatment, is a fairly urgent one, whereby a woman is diagnosed with cancer and then there's considerable pressure to treat the cancer, but to have the eggs collected and stored before the cancer treatment. So often freezing is done in a rush without any real consideration of what to do in the future with those eggs. For clinics, though, it may allow future treatment cycles, but also exposes them to considerable risk if there are storage issues. One risk is the eggs may not survive or fertilise. If a woman has delayed potential pregnancy for a long period only to find the eggs were not viable, there may be legal issues about information and consent. That is, that if a clinic has led you to believe you have a high chance of pregnancy when you're 25, having eggs frozen, and you return when you're 35 to try and achieve a pregnancy and the eggs do not survive, or they fail to fertilise or develop an implant. There will be a number of cases where they feel the information has led them to believe they had a high chance of being pregnant, and the issues about that then become legal. The other concern for clinics is the sheer scale of storage and the duration of storage and managing the thousands of separate clients involved. So in this context, most embryo freezing only involves about a third of cases and only involves 2 or 3 or 4 embryos. But when you're freezing eggs, you're freezing often between 10 and 20 eggs, all individually frozen, all have to be accounted for and audited, and they're going to be stored for up to 10 or 20 years. That is a long time. And the risk of some error, whatever, occurring increases with time. Another risk for the storage is that it usually involves an annual storage fee, which, if not paid or contact with the woman is lost, this becomes an issue for clinics. Since most countries place a time limit on storage, clinics may need to discard eggs without the client's consent once it passes a legal storage limit. And the issue of not being able to inform the client of that decision is a problem. Donation to donor egg programs where the recipient is unknown is an issue similar to sperm donation. The experience there is that some children will seek their biological parents, and it is expected to be the same for egg donation. Consent to donate can also be made after the client no longer wants or needs to spare eggs, but some consideration needs to be made prior to freezing. As we have recently seen where a clinic transferred the wrong embryos, it caused a huge social activity and vilification. This has impact on the viability of the clinic and its social license to practice. Based on this, clinics may increasingly decline to store eggs and prefer that a third party manage the storage and only receive the eggs when required. So in this case, you go to a clinic to have eggs frozen and they may refer you to another storage area, and so there is actually another party involved. So the take-home message, if you're planning on having your eggs frozen to use later on, then you should stop for a minute and ask yourself, what would you like to do with any or all eggs remaining in the freezer after you no longer need them? You do not have to make a decision now, but a basic plan to discard or donate them is actually recommended. If the clinic knows this basic preliminary plan, then that's all they need. Lastly, don't forget that they're in storage. Okay, I'd like to thank you. I hope this information has been of value. And if you have any issues, then discuss those with your clinic. Thank you.